Joining me now live is the New South Wales Shadow Health Minister, Ryan Park. Ryan, appreciate your time this morning. Does Brad Hazzard have a point?
Well, no. What I think people expect is for a Premier and Minister not to just put their hands up and say everyone's going to get Omicron. What we need is a plan for our hospitals, a plan for increasing our testing facilities, a plan for increasing our vaccination clinics. You don't just simply say everyone's going to get it, so we'll walk away. That's not leadership, and that's not what the community expect.
But do we need to change the attitude in the community when it does come to COVID? Does it take a deliberate public shift to learning to live with COVID, being exposed to COVID in the community? Because the experts have said it's about learning to live with it as it does become endemic.
Look, I think we all need to learn to live with it. But what I'm hearing from many people in my own community, but across New South Wales, is we've got a government saying go and getting tested. They turn up to go and get tested. They wait 5 and 6 hours. Yesterday, many were waiting hours on end and getting turned around. That's not appropriate. It's not appropriate that we have 400 odd people getting incorrect testing messages. It's not appropriate that people are waiting 3 and 4 and 5 days to get testing results back. You can't be saying to people, yes, we'll live with COVID, but on the same time, not providing the resources to our testing, our vaccination and hospital system to ensure we can do that safely.
The New South Wales government is looking to overhaul isolation rules when it comes to health staff. Would Labor support that?
Well, we've been in contact this morning with the trade union movement, both the nurses and midwives and the health services union, and no one wants to see health workers unnecessarily isolated, but the government needs to consult with the trade union and workers' representatives in relation to this, because what we don't want to see is a move made and then we have to rewind that and start again. We want this to be done in consultation with the workforce so we can ensure it's done appropriately, safely and managed correctly, both for individual nurses and health workers, but also so that the system can cope.
The system is obviously under pressure at the moment, and this morning the Victorian government has announced it is planning to allow close contacts to clear themselves from isolation with a rapid test rather than a PCR test. Victoria would be the first state to drop PCR requirements for contacts. Should New South Wales follow suit to help clear this backlog?
Well, we'll have a very careful look at this and make sure we get some feedback and advice from Dr. Chant and her team about the suitability of this. But we have said now for weeks that rapid antigen testing needs to be provided and provided free of charge to people to reduce some of the stress and burden on our hospital and testing network that we're seeing. What we're seeing both locally and across Sydney and probably across many parts of New South Wales is enormous queues and people waiting 4, 5 and 6 hours. Yesterday in Sutherland, people were turned around after waiting for many hours to get that testing. That's simply not something that we can do and ask people to do going forward, particularly over the holiday period.
But how much can be attributed to testing requirements, PCR requirements to go to Queensland or to Tasmania, for example?
Oh, without a doubt, that's an issue, and that's adding burden to our testing resources and the testing strains. While we've said we can get this free rapid antigen testing out to people as soon as possible, that should be an absolute priority in order to ease some of that burden on our testing facilities. But a Premier and a Minister putting their hand up and saying everyone is going to get Omicron without any explanation how our hospitals are going to be resourced, how our nurses and our health workers are going to cope, how our testing and vaccination clinics are going to be boosted and increased, is not about living with COVID. That simply doesn't make sense.
So what would Labor do differently then to alleviate this pressure?
Well, what we would be doing is focusing on providing increased resources, and if that's through contacting the Commonwealth, then albeit do so now, increasing the resources to increase the number of testing facilities, increasing our vaccination hubs, and make sure we are having in-depth conversations with the trade union movement in both the healthcare and the nurses to ensure that we have adequate staff and how we're going to manage the furloughing or isolating of staff over this difficult period.
Ryan Park, we have to leave it there. Thank you so much for joining us this morning.